Dr. Dennis Goodman, and I am a cardiologist and part of the Preventative Integrated Medicine program here. I'm actually Director of Integrated Medicine, and I was kind of the one behind this whole series because I really love the idea that we should be able to talk to people about being healthy from a prevention and integrated medicine standpoint.
So, many years ago, I don't recall it, probably in the mid 1980s, I was summoned to Lenox Hill Hospital for a woman who was suffering from cardiac arrhythmia. She was in her hospital room, and she was the friend, a friend who was a girlfriend of a very close friend of mine, who was a doctor here in New York, psychiatrist, and she was suffering from cardiac arrhythmia. So I came to see her because it was not really responding very well to the medical intervention and the medication and so on at that time that was given. So I came into the hospital, into her room, and we closed the door, made sure everything was quiet, and she cautioned the nursing staff not to bother us or for any reason, just to remain quiet and so that we could do this work without any interference. So I did a mental imagery, and I'll explain that to you a little bit more about this process. But we used the resource of her mind, the mental faculty of her mind, to find and discover an image, a mental picture that could affect the physical condition. What I'm talking to you about is a 5,000-year-old tradition in which it was understood before 450 years ago, when the medical model took root here as purely a physical, objective treatment modality. Before that time, the medical model, the healthcare model, was always known as a mind-body model. So that mind-body model had existed for about 4,000 years prior to the advent of this new direction that took place in the late Renaissance and the beginning of the Age of Enlightenment, when things took a turn and only the objective world became important. And Francis Bacon said that only what you can apprehend by your five senses here has any meaning. Everything else is ridiculous. I'm paraphrasing. Has no meaning. That means that the mind has no function, no currency. The mental life has no currency. Holiness has no currency. God has no currency. And of course, it was in part a rebellion against the authoritarianism of the church at that time and the opening up of the secular world in great measure. So only the objective phenomenon, what you could measure and quantify, had meaning. So the rest of it was kind of thrown under the bus, or at that time under the cart. So the using the mind and using the mental faculty to create some effect on the physical condition was clearly of no value and had no meaning. However, my work has been to continue that continuity that was discontinued over this 4.5 centuries ago. And so the work has been to restore the connection between the mental and the physical, and I will enlarge upon that in a moment, about 3 other factors that take place to give us an entire system of human existence. So what I did was we did an imagery for the arrhythmia, and she saw a golden triangle, a musical triangle in her heart, and on one end of the bars of the triangle was a yellow ball, and on one end was a red ball, and one end was a blue ball. And she had a mallet, a golden mallet, a soft golden mallet, and she started playing the triangle, hitting the 3 balls. And to understand that as she hit these 3 balls, she would understand that her heart rhythm was coming into order, that the arrhythmia was becoming rhythmical, as she could hear the sound of the triangle being rhythmical. As she underwent this and started doing that, the door burst open, and a nurse came running in. And we were both shocked, and she was really exercised, really, and she said, "What are you doing here?" And she said, "We were sitting in the nurse's station, and we saw that your EKG was normal, and we thought something was wrong." So they burst in to break up the process that we were doing. Nevertheless, we threw her out, and so we continued the process, and within a day she was discharged without medication, and the rhythm had come back to normal, and she never suffered because I knew her for time after that, and there was no suffering that was continued related to the heart rate interference. So what was going on? She was having a throbbing heart. It was not throbbing in a natural or normal way. Her throbbing heart was connected to a heartthrob because she had just broken up with this boyfriend that I mentioned. And so, in relation to the suffering that she was going through by the loss of this relationship, because she was intending and very strongly wanted to marry him, and he said in the final statement to her, "No, I don't want to get married to you, and we have to break up." So she had heartbreak. She had her heartthrob disappointed her. And so we have now added to the situation a social dimension. So years ago, when I was sitting with my teacher, sitting in the library of the Hebrew University in Jerusalem, around 1975-76, I had met my teacher in 1974 where I learned this work, and I had an unusual experience which changed the course of my direction about healthcare, my approach to therapeutics, how I would be working with people, and so on. And in that particular situation, when I met her, we had an interchange in the first 5 minutes of meeting her, and my life changed irreparably for the last 41 years. In that meeting, I came to see her with my ex-wife, who was doing an article on the role of women, the response of women to the Yom Kippur War, and how they felt about so many men were killed in that war, and what was the response of the women coming from many countries and with many cultural differences and diversity and so on, and how were they responding. I accompanied her to meet what she was told would be an interview with an Algerian woman. So I came along with her, and in meeting her, I understood I was in a special place, that this was an unusual setting. This was not just some ordinary person. I just had the sense of it when I walked in and walked through a beaded curtain, saw 1,000 pictures on the wall, Polaroid shots of various people on the wall. It was just unusual. And I was ushered in with my ex to her room, and we pulled up close. She said, "Please come close so I can see you better." And she said to me, "What do you do?" And I said, "Oh, I understand. The young man who I met, who had arranged this interview for her, I asked him. He asked me what I do. We were getting together each week and meeting to sit in Zen, and there was a Zendo up on the Mount of Olives there. And he said, "What do you do?" I said, "I'm a psychoanalyst." He said, "Oh, I went to psychoanalysis 5 days a week for 3 years in Paris. It did nothing for me, nothing at all. I met somebody here, and I went into a work called mental imagery, and within 4 meetings, everything that I had sought to obtain in the analysis was settled. My whole life has changed. I have a new direction in life. Everything is, the depression that I had been working on for 3 years is lifted altogether." I kept pace with this fellow over a period of the 6 weeks or so that I was there, and he did, certainly I saw no signs of any depression returning. But anyway, I sat up close to her, and I said, "Oh, you are his therapist. I understand. and he said he was doing something that I never really heard of called mental imagery. So she said she didn't respond readily to that, but I said, he said that he got nothing out of the analysis and he didn't do any free association. And I was an analyst. And free association was the center and is the center of analytic treatment. Say what's on your mind without any hindrance, without any qualms, without any inhibitions. Say what comes to mind and be open and free and be ready and be willing and able to say whatever you want to say. Wonderful. So I said to her, there was no free... I said, but it just occurred to me that Freud wrote an article in 1912 on beginning the analysis, which was an article for young analysts starting out to explain to them how to do this process. I had written a paper on free association and on a semantic issue, word issue, in the fundamental rule, it's called, of psychoanalysis, which is free association. I had sent it in for publication 2 months prior to meeting her. Afterwards, it was accepted and published. I still have a copy of it. But I said to her, Freud gave the rule of free association as an image, and I was really feeling full of myself. Whew! I came to this incredible insight. And he said to the young analyst as a beginning instruction, tell the patient that you are on a train with him, and he's to tell you what he sees as the countryside is passing by. He gave the rule of free association as an image, to see it mentally. The sidebar is that the only cure that Freud ever wrote about in the 25 volumes of his collected work was done by a mental imagery process, which happened in 1898 when he met a young boy who was 15 with a tic. And this boy had this kind of tic, a tic with his eyes. And Freud asked him, when did the tic start? And he said, I was playing chess with my father, and he was beating me. Oedipus Schmedipus, as long as you love your mother. So he said to him, close your eyes, go back to the chess game and replay it. And replay it and win. And he goes back to the chess game, he plays it, wins, and the boy's tic disappeared. It is the only recorded cure in the history of the psychoanalytic movement developed by Freud. It came as an image. He dropped it, and that was no longer part of his process from 1900 on. So she said to me, in what direction does a train go? What? I said, I'm talking about some incredible revelation that I just had. You're asking me about a train, and I'm thinking, there must be a correct, I went into analytic mode. There must be a correct answer to this. There has to be the right way. I'm getting self-conscious. What do I say? I'm thinking about trains. How do trains go? I come from Brooklyn. A lot of the trains are going horizontally. If you've been on trains in New York, they're going horizontally if they ever come. The 4, 5, and 6, if it ever shows up, is going horizontally, right? And I'm thinking, trains, what are we talking about? I mean, what is she at? I'm pulling back in the chair. I'm sitting in the chair, and I'm leaning back on the back legs of the chair. I'm sweating, gripping the arms of the chair. I'm breathing irregularly, and I'm feeling anxious and tight. And I'm thinking, in Machu Picchu, the trains go up. In the Alps, in Switzerland, they go up. Now I'm thinking there are horizontal trains and there are vertical trains. And what kind of city, what is this? And I said, and she's waiting for an answer. So I'm giving the medical answer to myself, and I'm about to say it to her. Not infrequently, most often, we hedge the bets so you're not having certainty because you're hedging your bets about how you're going to respond. Will this work? And so on and so forth. Not infrequently, most often, take a deep breath. Trains go like this. What I got to lose? Is she going to throw me out? What's going to happen here? And she said to me, she looked at me and she said, and if we change the direction, and her arm went in a vertical direction. And that happened, what happened was an illuminative experience. I had an illuminative experience, what's called in the East enlightenment, what's called in the West illumination. I had an illuminative experience, and I became a being of light. That is, I disappeared. There was no more this. It was gone. It was only light. It was only light. And there was no understanding or recognition of anything at all in this time-space world at all. Gone. And when I came back to my senses, she said to me, I see that you found this very interesting. I said, you bet I did. She said, would you like to learn more? I said, of course, because this to me is opening a door to truth about mental functions and about the use of the mind, because I was trained as a psychiatrist and a psychoanalyst. So she said, come back the next morning, and we started on a 7-year apprenticeship, going back and forth to Jerusalem 13 times in those 7 years for extended periods of time, from 3 weeks to 4 weeks to 2 months to 3 months. It was all varied. And I got my apprenticeship and my complete training in this work and graduated with this, from this apprenticeship in 1981. She herself was trained and had a degree in psychology from the Sorbonne. So, what has that got to do with being with Heartthrob and so on, and the university's library? I'm doing research. I'm wanting to find out more about this whole method and about where it comes from. I'm getting to understand that it's a 5,000-year-old method, that it's an ancient system of healthcare that existed in the ancient world of the ancient Holy Land, Greece, Egypt, ancient Egypt, and so on. There was a whole system of healthcare going on there, based on the use of and the function of mental imagery and physical experience. So I'm looking through a book that I pick off the shelf in English called Jewish Medicine. And it's a whole history of how it started, where it comes from, what's the genesis. I opened the book, and it says that the basis for this healthcare system is a social moral issue. That if a social moral issue goes awry and goes astray, that there will be, in regard to that, experiences of physical, emotional, and mental disturbances that will come as a result of this tapestry, this moral, social tapestry, having tears in it, being a rent in it, a pull, and opening threads out of place. The tapestry is no longer in order. And when the tapestry is no longer in order, then you have the conditions that come out of that to show us that there's something out of order in our lives. What's out of order is the physical, and with it, all the things that Dennis is talking about, eating disturbances. There is a sedentary life. There's obesity. People are not exercising. Lots of physical stuff that has to do with the body going out of order, and that also there are emotional and mental and social and moral disturbances going on. That there's a whole system of these 5 elements that are working together in conjunction, reflecting each other, not causing each other, but reflecting. So I understood with her right away, when I came to see her about the arrhythmia, that we're not neglecting that. We worked on it. It disappeared. She was discharged. She remained free of it afterwards. But we also put into place what her social disturbance was that was related to the physical. Every physical disturbance that anybody in this room has, any physical disturbance you have, has a social context to it. Every single one. And it also has an emotional component, a mental component. Emotional is your feeling states, your anxieties, your worries, your despair, your panic, guilt, regret, shame, anxiety, anger, and so on. All of that is there. Worry, fear, it's all there. It's all connected to the physical. And then there are mental states of confusion, that you don't know whether you're coming and going. You can't sort things out. You're trying to figure out what's going on in your life, but you can't put it together. There are mental disturbances. So there's a physical, emotional, mental, social, and moral. Why do I say moral? Because if you look at what Dennis is now putting together here, if you look for the root of the word health in the dictionary, the English dictionary, you're going to find that the root of the word, the etymological root, is K-A-I-L-O, kalo, out of which comes 6 words. Hale, H-A-L-E, hale and hearty. Wholesome, health, heal, whole. I gave you 5 words. Health, heal, whole, hale, and wholesome. What's the 6th word? The 6th word that comes out of that root, because all words in a language that come from the same etymological root are all organically related to each other. It's all what we call, it's a specialized word that some may be familiar with called a gematria. It's a gematria of words. It's that words are organically linked to each other if they come from a singular root. So, what's the 6th word? Health, heal. You want to be health. You want to be healthy. You want to be whole. You want to heal. They're all related. So if you're putting your life in order on the basis of what Dennis is giving as his input to patients about sleeping and about eating and about exercise and so on, if you want to be healthy and you want to become whole in yourself and give up the mental confusion and come into order, and you want to become healed, which means come into oneness, into whole, so that you're no longer feeling dismembered or at odds with yourself, or at 6s and 7s, torn apart. You want to come. The 6th word is holy. You can't have a health system without holy. In other words, if you want to heal and whole and become healthy, it has to incorporate that which I read in that book about 40 years ago. That there's a whole system that we have to deal with, which includes the physical, the emotional, the mental, the social, and we won't get into it today, but also that other aspect, the moral. They're all related to each other. That's integrative. That's an integrative system. That's an integrative system, and so if you reflect on your own conditions here today and start to think about it, you'll start to see that there are relations of the emotional, the mental, and the social going on in your life. Why is that important? Because if you bring it all together and you see the whole picture, and you're seeing how everything is interrelated to each other and how they're related this way, there's a healing mechanism in us that begins to kick in. That's what happened with her. That's what happened with her. Woman walked into my office in 1995, asthmatic, age 35, asthmatic since she was 2 years old, under the care of a doctor and having asthmatic medication given to her, an inhaler, and so on. And she came because she heard about my work, came to New York and wanted to work and do some, she was a clinician, a therapist, and she wanted to do something to add and have as a supplement to this work that she was doing with the doctor in the state in which she lived. We did an imagery exercise. I won't go over it, we did a couple of them. I won't go over it in detail, but you'll find them in a number of them in my book, which is a landmark book that was published in 1989 called Healing Visualizations, Creating Health Through Imagery. It's been in print since 1989 and going strong still 26 years later. Covers 80 daily ailments and many other things about how to do imagery and so on. So so we did an exercise about, she said, I feel constricted. I feel constriction in my chest. And I said to her, tell me the image of the constriction. What do you mean? What do you mean? And so you give me a word, I give you an associated image, because every word you use that's a verb or a noun or an adjective has, and sometimes an adverb, has its associated images. It's a natural and true language of the mental life. It's a natural and true language of the mind. So I said to her, give me an image of it. So we could even practice that now if you have difficulty in understanding what I'm getting at. It's very simple to know it for yourself. I find this as a regular test that I give to people to show that they can do it. What's the image of calm? Does anybody want to tell me what the image of calm is? I gave you a word, calm. Yes?
Water.
Water. What kind of water?
Sort of like an ocean with light falling on it and mild waves.
You got that? she sees an ocean with light falling on it, mild waves, and so on. It's calm. Fine. Did anybody, some other people had understood that? What's the image of peacefulness? Anybody want to venture that? Being peaceful. Yes, dear.
I think being in a rainforest.
Being in a rainforest.
Yes, and hearing the birds chirping, water falling, from the waterfall, like near the waterfall, the water.
So she's in a rainforest, here's the waterfall, here's the birds chirping, and so she's already there. She's already by the ocean. Everybody has this capacity, almost everybody. It's only 10% of the population that's not able to do this, really. So 90% or so can do this. So the original model was this combination of what Dennis is alluding to in the system he's starting here called mind-body. Mind-body. There's an intimate relationship between what goes on mentally and physically. So what's the image of anger?
Red.
Excuse me?
Red.
Red what?
The color red.
The color red, right? So you can see that it comes to you as an image of a red color, right? Okay, anybody else want to? All right, yes.
Fire.
You see it as fire, as flames,
Fire.
right?
I don't think-
Okay, so it's all there for us. It's only that we're turning your attention to it to see the relationship, because you call on your own inner resource to deal with that, it has a direct relationship to how the physiology changes. I've done research, which I'll share with you in a moment, to show this. And I've had 3 or 4 published research articles that demonstrate this relationship. She says there's a constriction on my chest. What does it look like? What? I said, give me the mental picture of it. She said, because she knew I did work in imagery, so she was sort of onto it, and she said, there's an elephant sitting on my chest. And it's imagination, and anything goes. It's all there. There are no rules of logic that govern it. I said, bring whatever you need to remove the elephant off your chest. So she gets a crane and some workers to come, imaginally, to remove it. And she sees it in her mind's eye taken care of. And the elephant is taken away. How do you feel? I can breathe easily. I'm able to breathe normally. I haven't been able to breathe this normally, and I don't remember when. We did a few other exercises about it to clear out the lungs. And she said, the asthma, as far as I'm concerned, the asthma is gone. That's what she said. I breathe easily. I don't have the wheezing. I don't hear the wheezing. I don't hear the wheezing. It's not there. She came in with it. She didn't have it. It's gone. And she called the doctor on the phone right then and said, I have to tell you, I've done this work, and the asthma is gone. I don't have the symptom here anymore. The wheezing is finished. He said, it's impossible. It can't ever happen. You can never be free of it, he said to her. So, after running 3 marathons in New York City and running those courses asthma-free and living a essentially asthma-free life until, 20 years later. Okay. When did what occasioned these episodes? Well, what did? You probably know by now what occasioned the episodes. A boyfriend. A relationship in which he promised her that he was going to marry her. He promised that he would do that within the next week or 2 or whatever it was, that he was steadfast in his resolve to marry her. He had been living with her for a while, and she wanted to marry, and he promised that he would marry her. And then at the last moment said, I'm sorry, I'm moving out, I have another apartment, and you will have to, and we will, we'll not be together this way. And the asthma comes right there. A friend of ours, her husband leaves her. Her husband leaves her. He's packing up in the apartment to go. and he is packing his suitcases, and his daughter comes in. She's 8 years old, and she sees him packing. And she says, "What are you doing?" He says, "I'm leaving." She developed an asthmatic attack right on site at that moment. We got to see the relationship. We got to see the relationship. You got to see it because it has to do with a whole system that can be brought to bear that can bring the healing effects into play. That a person can get over illness and see that there's a relationship going on, and that can be taken care of on a physical level, and it can be intervened with on a mental level through the imagery and so on. And so it has an application for dealing with the whole person. The whole person. So we're interested in the science of disease, which is medicine. We're interested in the science of disease, in the science of these disease entities that come: cancer, arthritis, asthma, cardiac disease, all of that. We're interested in the science of disease, but we're also interested in the science of human being and understanding the whole human being, to see the whole picture, to understand what it is to be human, and to bring that into relationship and into focus, to see how that's all connected, that it's all of a piece. It's all of one piece. So the work the work in asthma. My dear friend Elizabeth Barrett, who's sitting here, who is a world-renowned nurse and teacher and researcher, over 100 or so research experiments throughout the world in her theory of power, which has had reliability and so on, and has shown to have efficacy, etc. We did a research project at Lenox Hill Hospital on asthma. Treated 16 patients or so out of a group of 200. We had a strong attrition rate. They came and they did the work. And I took care of all 16 of them. I think it was 16.
34.
Oh, I'm sorry. Shouldn't be a total loss. It was 34. It was 34, I forgot. Okay, thank you. So I worked with all of them. And so they were all adults, and they were all in therapy, all in psychotherapy. And I said, I understand you teach one. I saw each one individually. I said, you're in psychotherapy. And they said, yes. I said, well, do you talk about the asthma with your therapist? Oh, no. I only talk to the pulmonologist. I said, well, when you see the pulmonologist, you talk about your social, your conflicts and your emotional oh, no. I only talk to my therapist about it. You see the difficulty that you have Plato's dilemma of the elephant, and that each person is touching the elephant in the dark cave and think they got the whole thing? They don't got the whole thing. We got the whole thing. It's all been there for 5,000 years, sitting and waiting for us to put the whole thing together. So we did it with these patients, and I gave them 1 hour, and we met and we talked about the asthmatic condition that they were going through, what they were taking, what the emotional issues were in their lives, and so on. Interestingly enough, every single one, the asthma came as adult, in the adult phase, came as an environmental pollutant, an environmental toxic exposure. In their workplace, in facing strong amounts, intensity of carbon monoxide from garages, all kinds of things. There was a strong environmental component. So I gave them the imagery exercises to do. I gave them a program, and we followed them up over a course of coming back to me over a period of time, I think of 4 weeks. And nearly 50% of them reported that they were off their medication altogether. And in the control group, the report was that 18% had reduced their medication somewhat. That was the result that we got. We followed them up for a much longer period of time, and we found over the follow-up period that they were still maintaining their health, and we also investigated their quality of life. because we relate it also as we're talking about the social and social functions and social issue, and we're talking about the quality of life and how the quality of life plays a role in their conditions. It's all of a piece. And the quality of life, we discovered, had markedly improved. Yes.
And their power.
Excuse me?
Their power.
Their power, the power that they found for themselves, their self-empowerment, in which they took charge of their life on the physical level, on the emotional level, and on the social level. They took charge of their life. So we understand that there's, from this whole system, that there's a collaboration that can take place, a partnership that can happen between us as medical practitioners and people who are coming, who are sufferers, seeking help. That there's a partnership in which they can be, the two of them can come into a relationship with each other and help collaborate with each other and partner with each other to see about what the person can do for him or herself, which is of paramount importance, to be able to do for themselves. So I went to the Mount Sinai School of Medicine, was starting a course for postgraduate course for doctors in certain subjects that they wanted to teach doctors about patient care. And I went to the head of it, and I said, I'd like to give a course here. He said, what kind of a course do you want to give? I said, I want to give a course in healing. What? What do you mean by healing? I said, well, let me give you an example. The heart is an organ that has to do with our relationship to love. Everybody in this room here knows that the heart and love are related. There's nobody in this room that can deny it. Valentine's Day comes, and you know it because you're giving boxes of candy shaped in the form of a heart. You're sending Valentine's greetings with hearts on them. It has to do with heart and love, are known throughout the ages in Western literature, and allied subjects, plays, and so on, that love and the heart are related. I hope that no one here would take offense at that or seek to deny that. You have to know that. So I said to him, the heart and love are related. So when patients come into me who are showing that they have heart disturbance, I don't neglect. We're not talking about neglect. We did imagery for the arrhythmia. We did imagery for the asthma. We did imagery. We did imagery. We're not neglecting. We called into play their own mental power. We showed that they had the power to take care of themselves and do something for themselves, that they didn't have a wholly dependent relationship necessary on the treater. And to understand that they could establish that own inner power is incredibly healing. So, so I said to him, when the patient comes in, we look at what the organic issue is, and then I say to them, are you eating your heart out over something? Are you suffering heartbreak? Is something happened to you that's heart-wrenching? He sat up and he said, this is so ridiculous. How can I tell you? I don't know how to put it. It is so, I never heard anything so ridiculous in my life. The heart is a pump, and the arteries that feed it, that it feeds and so on, are fuel lines. It's merely a pump with fuel lines that send nutrition to the rest of the system. All it is a mechanical thing. It's nothing more than that. He said, you know, I can't understand what you're talking about, and I can't offer you a place to give a course. I said, I'm sorry to hear that. I said goodbye. He died a week later. He died of a heart attack. He was a cardiologist. I did not know that. So when I talked about the heart and love and the disappointments in love and what goes on and so on, I didn't know to whom I was speaking or what his background was. I'm not implying that our conversation had some effects, but it was just interesting to me to note that the cardiologist was so firm about the role of the heart and what it does, has a heart attack, and has heard me giving a kind of semi-lecture about the relationship of heart to love. I don't know what his love life was like, and so on. I don't know if Dennis here or Al Gass, who's here, who's head of chief cardiologist for the transplant unit at Westchester County Medical Center, if they found this to be the case, that the people coming with heart trouble are suffering in love, and so on. Has it been asked? Have you asked the asthmatic patient about their difficulties with crying or yearning for freedom and inner crying and a relationship and a dependent relationship that has been lost, like the man who promised to marry her, and she was so dependent on this as her last gasp and possibility for having a possibility for marriage. She was 35 and came from the used woman shop. That's how she saw herself, and so on. So we're talking about the relationship of heartache to the heart, and that was the focus that Dennis put up on the chart, to look at the relationship of heartache and heart, and so on. And we're talking about an overall picture of how to look at the matter. Now, I did research with Elizabeth. We had, I think, 2 or 3 published papers on quality of life and quantitative function of the heart, of the asthmatic condition, and how quantitatively we were able to show that things changed, and so on. And I did research in a very difficult environment on the heart. I went to James Madison University in Virginia, 16,000 students. We set up a research design in which we would see a group of, this group of students was 90 students. 30 were seeing me. I saw every single one of them, just like I did in all the other research. I saw the kids independently, each one independently. They were in final week. They were approaching final week. Can you imagine that, going into finals? These kids are 18, 19, whatever it is, and they are under a considerable amount of, I will say, and I'm going to talk about it for a moment, stress, which doesn't really exist in the way that it's understood in public consciousness and mass consciousness. It does not exist. The medical profession, the psychological profession, takes it up as a meaningful term in the way they approach it, and I want to put a little tweak on it. So they were in a very stressful situation, very stressful. So there were 30 students who came to see me, 30 students who did affirmations. They would just think, my heart is well, everything in my heart is well, the heart is functioning perfectly and all of that. And 30 who were to do nothing. If it occurred to them to think about the heart or to focus on the heart, fine. You walk around the campus, and if everything is hunky-dory, you just if it comes to mind, you think about it, and so on. So they were doing nothing. These people were hooked up to a heart monitor, and they were being evaluated on a computer that was sitting in the room. They had a pulse meter on their finger, and so they were being quantitatively assessed for what was going on with them and me. And I gave them an imagery exercise to strengthen heart rate, for heart rate strength and variability, to increase heart rate strength and variability with these students, who I asked them, after I gave them the imagery, to go about their week noting and making some notes if they wanted to, but doing this as an assiduous practice every day, to do this practice of this imagery I gave them, at least once a day, if not twice. I don't remember exactly what. We did a follow-up on them after finals. And the results show, and it came out in our paper called Psychophysiological Coherence as a Function of Mental Imagery Practice. What it showed, that the heart rate coherence and strength and variability was off the charts. The affirmation was okay. The nothing was flatlined. We did it again the year later with a whole different set of students. Same result. Except this time we added something to it, and it was published in in a paper after that called Microdevelopment of Daily Well-Being, the Mental Imagery Practice. They again, like we did in the imagery work with asthma, again showed that their daily quality of life improved. They were living a different quality of life. These are 19, 20-year-olds. The asthma people were 40, 50, who were chronic asthmatics and so on. So I come back to stress. There's not one person in this room, including myself, who hasn't today, from the time you got up this morning to the time you arrived here, hasn't experienced a stressor, that you haven't experienced stress. There's no one in this room. If you're telling me the truth, please raise your hand that you haven't experienced a stressor between the time you got up this morning to the time you got here. Of course not. Everybody experiences stress. It is the way of life. It's the nature of life in this world in which we live. It's chronically a stress-creating life. It has to be this way. I can't get into the spiritual metaphysics of that, but there has to be stress. You have to face it. It has to be there. The issue isn't stress. I don't want to reduce stress. You can't possibly seek to create a life in which you're evading stress. We're not Howard Hughes. We're not going to go into a hermetically sealed room to prevent ourselves and to get away from all the germs and all of that stuff. We're not doing that. You can't avoid. And anyway, he had an incredibly stressful life living in that room. And so you can't avoid stress. We're not interested in that. We're interested in the response to stress. What do you do about the stress that comes? Do you handle it with distress, or do you handle it with equanimity? How do you handle it? That's what's important for us. Everybody that comes, that you, in your family life, what you're experiencing in your daily encounter with others, going to the supermarket to shop, going to the movies, you're going to hit a stressor, hailing a cab. It rained today like crazy before, right? I got caught in the rain, I got soaked, and there were no cabs and so on. It's a stressor. You can't avoid it. It has to happen. It's what you do with it. That's the name of the game. It has to be dealt with in a way that you're equanimous, that you're in balance with it. And that's where our function of mental imagery comes in, to create that kind of healing process where you can handle the stressors that come in an equanimous way, where you're not bowled over by it, where you're not suffering from physical disturbances that are coming in the physical realm with the stressors, that you're not suffering emotional difficulties, mental confusion and so on, and all of that. There has to be. So we want to really see about using this function of mind, that's our own internal power, to take charge of our inner state of being. And by taking charge of our inner state of being, we're going to have an immense effect on our physical life and emotional life, social life, mental life, and as well as our moral life. In this short period of time we had together I've had to kind of jam in some stuff in a way, kind of, for me, thumbnail about how this works. But as long as you walk away understanding that you're not reducing stress that you see, because the pills are a temporary fix, the stress is not taken care of. And so we face the stress and we deal with it and how it appears to us. A student calls me. I know I have to meet you at a certain time. I'm at the UN, and there's a UN meeting of all the thieves, drunkards, and murderers who run the world. They're meeting at the UN, and there's a police presence there to beat the band. And First Avenue is blocked. I'm down about 20th Street, and I know I got to get there. My office is on 84th and First. I got to get there. I said to her, imagine the Red Sea parting. and that the car shoots right through. She closes her eyes and she imagines herself and sees the Red Sea parting, with the waves parting and a road, a clear path opening up. The cab driver says to her, turns around and says, I don't understand how this happened, but we have a clear path right now. And she shot up First Avenue and got to the meeting that we had. You have to understand the power that you have about being able to change your condition and to be able to rely on yourself in collaboration with the clinician to combine to create a collaborative partnership for this healing effect. And not only that, but that partnership that's created in this collaboration is incredibly healing. It's a major function of the process, because the person who welcomes you and sees you and understands you in this way and understands your own inner power, and that you have this process available to you in this available way that can be so useful, is of immense importance in the relationship. So you're seeing each other as real human beings. Remember, I mentioned earlier on, it's the science of human beingness. It's the science of becoming human. We're interested in the science of, generically, I use the term, we're interested in the science of man. So there's a science of disease and there's a science of man, and they have every possibility of melding together and becoming one. I don't know, is that okay?
Fantastic. Let's give Jerry a hand. And just before we take questions,
Yeah, I used to be on the Speakers Bureau of the American Diabetes Association after I reversed my type 2 diabetes.
That's a sweet deal.
Yeah. Now, after I losing the weight, and after I gained the weight back, I didn't think I was good. But anyway, my question is, doing my research of all this stuff, I learned that that people who have type 2, I don't know about type 1, but type 2 are as I don't know, unless there's new research, have as much likelihood of developing a heart attack or heart condition as somebody who's had a heart attack, and the risk of
What's the
them
question?
having another heart attack is
What's the
about the
question?
same. So the question is, have you dealt with people who have, let's say, type 2?
I've dealt with people with diabetes this way, whose diabetes has the meaning of bitterness and resentment. So there's a strong bitterness and resentment issue in their lives. And so there's a relationship between the physical, the pancreas, and bitterness and resentment. Developed an imagery exercise, and 2 people have told me within the past 3 weeks that their insulin abnormality has come back to normal. And they take a violet tube, a tube of a laser, a violet laser light. The tube that the doctor would look down your throat with, he presses the little cap, and the light and the laser beam comes out, and I have them wash the body and the tail of the pancreas 3 times a day for 21 days, washing it with this violet laser light. 2 people have told me in the last 3 weeks that their glucose insulin ratio has come back to normal. That's what I do. We're not going to deny other possibilities of what you've been taking and so on. We're talking about how we would approach it on this level to ask you about what's the bitterness and resentment in your life. Where is that? Where is it focused? And so on. So, are you related? Well, we won't talk about it now. But no, I'm teasing. But the thing is that we're using your mind to create healing. We're experimenting, because the only way you know is to experiment. Your life is not at stake. In none of these diseases that are named is your life at stake. You always have time to experiment, to find out about using this kind of inborn capacity that has been given to us, that we have our own mental power to do that. Going back and reinstating a 5,000-year-old tradition. That's
Okay.
all.
Thank you.
Okay.
2 quick points, outstanding questions. Research has been done that diabetics have the same risk of heart attack in the next following 6 years as someone who had a heart attack. We treat diabetics as if they've got heart disease. That's to your point. The other point is it makes complete sense what he's saying because high cortisol levels, okay, which is stress, raise your blood sugars. So if you're doing this guided imagery, to me, it's not how's this working, it doesn't make sense. Anything that lowers your adrenaline levels is going to help you. Anything that kicks up the parasympathetic nervous system, where you slow down, your heart rate slows down, is going to help you.
I'll give you an exercise right now to calm your heart. Remember, I did the heart rate business, but there's a breathing that you do a certain type of breathing, and your parasympathetic system is kicked in because it's related, and you'll become quiet, and you'll find changes in your blood pressure and your pulse rate. A very simple thing, and the anxiety that you're feeling disappears. It's simply this, and I'll demonstrate it. We do a certain type of breathing. It's called parasympathetic breathing. So you breathe out long and slow through your mouth and normal through your nose, 5 times. Brief. Long. If you all do it now, you may start to feel something. Like that. Just do it like that. And we've been able to show by taking pulse rates and blood pressures how it all shifts and so on. By the way, this is not called guided imagery, just as a corrective. It's called mental imagery, not guided. You're finding it for yourself. We're just giving you the stimulus to go and do it, the access route to do it. You're the guide for yourself.
And each person finds their way to do what I use the term stress management. So every person I speak to, I say, what are you doing for stress management? I have a whole lot of resources. Some people it's acupuncture, some people it's biofeedback, some people it's transcendental meditation, some people it's the mental imagery. Everybody's got to find the thing that makes sense and works for them.
Experiment. You have to experiment because you have time. Your life is not at stake. There's no diagnosis that you get outside of certain acute ones that your life is at stake. Even with the diagnosis of cancer, your life is not now at stake. And you must remember that. That's a great stressor, and your response to it has an impact. Because if you're given that kind of a diagnosis and you get said, oh, it's a death sentence, now you have the belief you're going to die. And now you're walking around with this internal stressor and this internal distress of, I'm going to die. You see, and now it weakens the whole system. So you always have to remember that you are facing a stressor constantly, and you can deal with it in this way. We have many different applications and possibilities.
Question.
I'm wondering about the relationships. I do mindfulness awareness when I'm sitting on the subway,
Yeah.
and usually when things would come up, like screeching or loud argument or something like that, I'd either try to ignore it, which of course didn't work, or try to transcend it, which was also impossible.
We take another stance towards it too. Another way you could look to investigate further is that nothing happens to us by chance. What you're facing is that the universe has given that to you in that moment, to you specifically, not to me. I didn't hear screeching. You heard screeching.
Right.
So you wanting to find out for yourself who's been screeching at me. When Dennis said, "Who's the head?" We always ask, "Who is your headache?" Who's the? He says, "Oh, I got sciatica." So we say, "Who's the pain in the ass in your life?" I got bladder trouble. Who you pissed off at? You see, there's a relationship between all of that. So who's screeching at you, and who has been the screecher in your life that you're trying to avoid? Who just recently screeched at you for what you think is no reason, and so on. So you now can investigate and get a larger, what you say, the larger scope of things in the human relationship. The human relationship. It all starts with human relationships. It's the basis, the center of everything. In a socially shared world, it is the center of all human relationships, and they're going awry.
I'm open. I have a hearing loss I've had. Now, are you saying that we caused the condition?
No, It's what we call an error of living, in the sense of we would first ask, who have you been turning a deaf ear towards? Or what is it that you haven't wanted to hear? We're not neglecting examining the ear and seeing what the functional issue is or the organic issue. But we are also asking, who are you turning a deaf ear to? What is it that you haven't wanted to hear? And so on. So
But I
that's,
don't wanna hear?
excuse me?
You think what I don't wanna hear?
Yes,
That's
what you've heard that's been a shock, that has been traumatizing to you, what you haven't wanted to hear, or what you've turned a deaf ear to in your life. A man came to me who was blind. He was evaluated, diagnosed as blind, and we got to understanding about the relationship of guilt to blindness, relationship of guilt to these eye problems. Why? Because in the Greek myth, Oedipus, when he finds out that he killed his father and is sleeping with his mother, unaware, presumably, he is so ridden with guilt, feeling indebted. Guilt means to be in debt, and he rips his eyes out. He blinds himself. So what indebtedness, what guilt have you been suppressing or not wanting to experience for yourself? So he was a man of some means, and what he did was he forgave a relative, a nephew, a debt that was owed to him of $80,000, and he forgave it. And that, in addition to doing an exercise, he came from a Catholic background, and he saw himself washing his eyes out in a holy stream, like Lourdes, and then Jesus came and spit into his eyes. And then he replaced the eyeballs back into his eyes. When he went back for his examination about 6 months later, the blindness had healed and his optic nerve recovered, which was atrophied. And so why does he have the healer spit in his eye? Because you know from that background that Jesus, a blind man was able to see by his spitting in his eye. Yes, Larry.
Jung said, every disease is a failed attempt at a cure.
Is a failed attempt at a cure.
Sure.
And the interventions that you're suggesting are a choice. Take that instead of the disease and maybe have a better life.
Experiment to find out what works.
Now let me tell you, as a scientific doctor, if Jerry told me that story and I didn't know him, I'd say I don't believe it. But I can tell you what, I believe it because he told me. And it makes you realize, even for myself, who really takes this stuff on board, there's times you just can't believe it, but it's real and it's true.